Hi, my name is Kathleen and I wrote this book, Loving Choices, Peaceful Passing, Why My Family Chose Hospice. And today I want to talk about just how difficult it is to bring up the topic of hospice care to a seriously ill loved one. When I was manager of the Health Insurance Counseling and Advocacy Program, I spoke often with senior citizens about what Medicare covers. And when someone would describe a seriously ill family member, I'd say, well, maybe at this point it might be a good idea to consider the Medicare hospice benefit. It's quite generous. And they always responded, oh no, we can't give up. We can't do that. And it wasn't until several years later that I truly understood how reticent we family members are to bring up the topic of hospice because we just have that idea we're giving up. We live in a culture of cure and continuing medical treatment at all costs. In 1998, my dad was diagnosed with colon cancer, and he had 3 months of chemotherapy after the surgery, and he never really was himself after that. He developed a condition called rotatory nystagmus. He was pretty much blind. He could only see forms and shapes, and he couldn't see his computer screen or the TV. And he developed some painful conditions that really bothered him, and he was pretty miserable most of the time. In the summer of 2000, 2 years later, my sister Ann and her family and my husband and our kids went over to the retirement community where Mom and Dad lived in Prescott, Arizona, to celebrate his 80th birthday. And during that weekend, when Dad and I were alone, he said to me, I don't want to live like this anymore. And I was really taken aback, and I didn't know what to say. There really isn't a lot to say when somebody says that. But I did commiserate with him. And then Mom came in, and she was ready to go down to the dining room in the retirement community for dinner, so our conversation ended there. And it was just 2 weeks later that he was diagnosed with non-Hodgkin's lymphoma and given 4 weeks to live without treatment. So he started radiation treatment 5 days a week, and I would call Mom to see how it was going, and every time I talked to her, it was worse and worse. She said he stays in bed all day, he can hardly get out of bed. We have to take him to the Medicab in a wheelchair because he's so weak. And I remembered the conversation Dad and I had, and I thought about picking up the phone and calling him and asking him if he really wanted to continue these treatments, because he told me he didn't want to live like this before he started these painful treatments. But again, I just thought, well, Dad will think I'm giving up on him. So I never did make that call. And I regret that to this day. Well, after the 3rd week of radiation, Dad was taken from the oncology clinic to the hospital because he was too weak to take the treatment. And at that point, Ann drove up from Scottsdale, and I drove over from my home in Monrovia, California. And Mom and Ann and I had a talk about Dad's condition. And the 3 of us agreed that we didn't think this radiation was going to cure his cancer. And we also agreed that we didn't want to see him suffer like this anymore, especially Mom. It was very hard on her to see him declining day by day. And now Dr. Archer said he would need a stomach tube to continue the treatment. So I said to them I would call Dr. Archer the next day. And I reached him at his office, and I described to him how miserable my father was, that the quality of his life was 0. And Dr. Archer said, well, he'll need the stomach tube to continue the treatment. So I finally said, we think it might be time for hospice. And he said, at this point, that's a good thing to consider. It's best when the family decides. And that made me feel better that he agreed so quickly that hospice would be a good choice now. And then I asked him to help us talk to Dad about it because we couldn't do it ourselves. And he said, doesn't your dad know he's dying? And I was really taken aback because then I knew he knew how close to death my dad was, but he wouldn't suggest hospice until a family member did. And I said, yes, I think he does know, but we need your help. And we did need Dr. Archer's help because you can enter the Medicare hospice benefit if a physician certifies, based on his assessment of the patient's condition, that that patient has 6 months or less to live. So we needed him to make that happen so Dad could enter the hospice program. So he came to the hospital at 5 p.m. that night, and he went over to Dad, and after a few words of conversation, he said, Mr. Valley, we consider guys like you terminal. And the room got quiet, and I felt like the worst daughter that ever walked the face of the earth. I just felt this crushing burden of guilt. But what Dad said next really changed everything for us. He said, thank you, Dr. Archer. I've had a good long life, and I'm grateful. And he was telling us that he had accepted that he was dying, that he did not want any more treatment, and he wanted to go home. And he even ended the conversation by saying, I want to get the hell out of here. So the next day, the hospice nurse came to his room in the hospital and told me what I would need to do to get the apartment ready for Dad to come home. I needed to get some medical equipment for him, the hospital bed, a wheelchair. I made arrangements with the RN at the retirement community to have their meds delivered, both Mom and Dad's, and all the other things that hospice requires to take patients that are so ill home to be cared for. On Thursday morning, the Medi-Cab brought him home, and the attendants got him in his hospital bed, and he was looking around. He saw that he had everything he needed, the oxygen concentrator, the suction machine, and he started to relax. And his mood just got so joyful. He was just so happy to be home, and Mom was happy, and I was happy. And then the home health aide came in with his meds, and he knew that he was going to get that taken care of. And then he got kind of giddy, and he said, I want to eat dinner in the kitchen. He'd been flat on his back in a hospital bed for a week, and he wanted to sit up at the table and have his dinner. So I got him out of the hospital bed and into the wheelchair into the kitchen with the oxygen tubing intact. And the three of us crowded into that little kitchen, sat around the table. We had ordered our dinner from the retirement community kitchen, and they had pureed his food. And he was cracking jokes and had a martini. And we were all just so happy and relieved. And when I looked at his face, all of my doubts and my trepidations just melted away, because I knew he was where he wanted to be, and Mom was where she wanted to be by his side, and that Ann and I could provide the care he needed so he could pass in peace. And he did pass away in his sleep 29 days later in his own home on his own terms. And during those 29 days, he was able to get his financial affairs in order. He reconciled with 2 of his estranged children, and he prepared himself to walk into eternity in a peaceful way. And many people say, oh, we chose hospice too late. We got our loved one home and they died a couple days later. So my suggestion is, if you are thinking of hospice care for a loved one, you can suggest it to them and describe what's provided. And if they say, oh, I'm going to fight this to the end, I'm going to fight, then you help them fight. But they may be ready to lay that burden down of trying to get better. And you can help them with the help of hospice to have a peaceful last few days on this earth. And you can spend it with them. Again, the book is Loving Choices, Peaceful Passing, Why My Family Chose Hospice. You can buy it anywhere books are sold online. I hope you'll pick up a copy and give it a read.